Hello, my name is Dr. Jeff Aberle, and in this video we are going to discuss the most common causes for headaches. And most of you that have headaches that are going to be watching this really don't know what they're coming from. You're probably thinking it's stress related. You've probably been checked out for any oddities like cancer or tumors inside the brain. I mean, sometimes those are very sudden and acute onset types of headaches, and sometimes they're slow onset. That's not what I'm going to be talking about here. I'm just going to talk about the typical headache and the reasons for it and how to go about solving it. So here I have a 3D model, and we're going to use this to discuss the headache type cycle that people have. And some people can get headaches behind the eyes, around the eyes, and the temples. Sometimes they're on the side of the head, sometimes over the top of the head and all the way down to the back. So they start down around here and they come up and around the head and into the into the eyes. So all these different types of headaches, believe it or not, are somewhat related, and they are caused oftentimes from a thing called a cervicogenic headache. Now, cervicogenic just means coming from the neck, and there's multiple reasons for this again. So let's look quickly just in terms of structure, and we can't get into a lot of details here because there's just a lot of animations that would have to be made to get into a ton of the details. But when it comes to the neck musculature, you'll all relate to some of the deep muscles in here that we'll show. So here I'm going to take away the trapezius, and down in here sometimes people get their headaches actually through these muscles. Okay, and so this is the splenius capitis muscle, both sides here. I thought you could see the label over here, but you can't. And then we'll rotate that around and we'll take away the splenius capitis muscles, and we've got these muscles, and these are called the semispinalis capitis muscles. So we'll take away those again because headaches can come from these, where these muscles tighten out. And I'm going to hide those and hide that, and now we get into some of the deeper muscles of the neck. And if you have headaches and you've stuck your finger up here and pushed on these muscles, not this one per se, I'll remove that one, but some of these smaller ones, you can feel these are very tight and contracted, and when you push on it, it either relieves your headache or it actually increases it. And if you massage that, it might increase your headache while you're massaging it, but then it relieves it a little bit afterwards. So why is that the case? Well, if these muscles are contracted in the neck, they can cause a lot of distortions up here, and they can also trigger the thing called this concept where you get kind of like an ice cream headache concept, where the pain fibers from these muscles, as they're going into the brainstem, the spinal cord, they can actually kind of like crosstalk with the trigeminal nucleus, and that concept will actually give you headache pain along the face, okay, in the eyes usually, and sometimes up into the forehead and down through here. And that can happen very easily from that trigeminal nerve nucleus influence, and that's from pain fibers being stimulated through here. And you don't necessarily feel the pain here. That's the odd thing. I'm not really describing it perfectly. It's actually called nociception, but it's the pain fibers in here, the nociceptors, which detect injury, are actually being fired, and on their way up to the brain, they crosstalk with the nucleus that handles and is responsible for facial pain. And that's how you can get facial pain sometimes from these spots right through here. That's a very common reason. The other thing that can happen is that you can get distortion actually in the meningeal tube that's deep in the spinal cord here. And we're not going to go into that. It shows it, I think it shows it here somewhat. The lighting just isn't right, but you can see the spinal cord in there, okay, that yellow thing. And that yellow thing, oops, has around it a tube-like structure called the meninges. And that, if that thing gets twisted and distorted in such a way, that too can give you intense headaches. And until you get those meninges released with some specific chiropractic adjustments through the advanced biostructural correction technique, you're not going to relieve that tension. And then the headaches will just come back and come back and come back, and they'll never really seem to go away except temporarily. So you have to get at the root of the cause. So that explains some of the mechanical things, and your posture and everything is all related to this. If you have somebody with a very forward head posture, there's no way this is ever going to go away on them. in a permanent manner, you have to change the structure and change the posture. Because what happens to a lot of people is their head's so far forward that this neck, instead of going, at a nice curve like this, notice how this kind of curve coming up? You can see it back here. Their head is far forward and their neck is actually straight or reversed, going this direction. And all these muscles up here then have to contract just to hold the head level with the horizon. So if you can picture this whole vertebra right here being shoved forward a couple inches, okay, this head would go down and start be looking down. But you then use these muscles back here to contract and tilt the head backwards, so that you can still look straight. And that keeps these muscles tight and contracted. And there's no way they can't contract. Otherwise you'd be looking down at the ground all the time. And you tend to want to look out on the horizon. It's just how humans are. So that is a big reason why we get the headaches. And the mechanical reasons can be handled, like I say, with advanced biostructural correction. The nutritional reasons for these headaches are very exciting, actually. You can actually have, I'm not going to get into too much detail of this, but you can have a nutritional deficiency which causes these muscles right through here to tighten up. And chiropractors will go in and they'll feel the muscles right around the C2 just locked up and tight as can be. And they go ahead and adjust this area and it gives you relief for a few hours and then it tightens right back up again because the nutritional reason has never been addressed. And boom, you're back to hurting again. Another nutritional deficiency can actually cause these muscles to tighten up. And that's kind of a bizarre one. You would never think that. But when they tighten up due to this nutritional deficiency, that too will give you headaches. What's interesting about this one down here is if these ones here that prevent this vertebra, C2, from moving real well, you'll also sometimes have a little bit of dizziness or vertigo. Sometimes it's just positional, and this doesn't happen with everybody. But if they do have this, where they bend over and they get up and they feel just a little dizzy consistently, then they probably have this nutritional deficiency that's causing this to stay contracted, and you need to address that. And I have the technologies in my office. I have the training to handle those nutritional deficiencies. So you deal with all these little tiny muscles here with the nutritional deficiency. You deal with these small muscles here with the nutritional deficiency, and then mechanically you've got to address this, because if these have been tight for a long time, you've got to address the mechanics of the problem and deal with all the postural problems that have happened in the entire body over the many years that you've had problems. And that's how you go about solving the headaches. And it's usually fairly quick and fairly easy to get rid of even chronic headache problems that people have had for many years. Only occasionally is it challenging. But the case that you might consider yourself challenging, but it's probably a very simple case. And just because you've had it a long time doesn't mean it's challenging. It just means that nobody's found the right reason for you yet. And so you come into the office and I find what's going on here and get it handled, and then your headaches go away, and then you figure out how to prevent it and how to solve the problem, so you don't have to deal with headaches on a regular basis, if at all. I can't remember the last time I've had a headache, and that's how I got into chiropractic, was with headaches. So I hope that explains a few things. Again, it's these problems in the neck cause pain that comes over the back of the head, into the eyes, into the temples, all this stuff. It's very straightforward to solve, and I hope this educational video was very helpful for you. If you have any questions, please call our office or check out our website for more information. Thank you.